Good evening, ladies and gentlemen. I'm Dr. Pranati Reddy, Clinical Director of Birthright by Rainbow Hospitals. This is the division of Rainbow which takes care of pregnancies and deliveries. I welcome you all to this knowledge sharing webinar that we are holding today. COVID-19, the disease caused by the new coronavirus, has rapidly spread globally. Now it's been classified as a pandemic, and we are all aware of that. It has impacted many aspects of our life, and it has also impacted our ability to provide care to patients. But pregnancy and childbirth are unique. This is because outcomes of pregnancy have a direct impact on the future health of societies and nations. And therefore, it's absolutely imperative for all healthcare systems and hospitals to continue to take care of pregnancy, pregnant women, and ensure healthy outcomes. To that end, pregnancy is classified as an essential healthcare service by both WHO and ICMR. Pregnancy is also a joyous experience, but there are a lot of aspects of care during pregnancy which are time sensitive and which, unless accomplished at a particular stage of pregnancy, will be of no use to that woman. So we as a hospital have worked very hard to balance this antenatal care by modifying it to actually reduce the number of visits to the hospital, by providing protection to patients when they visit the hospital, and by providing protection to our own healthcare workers. Let's go ahead and discuss how in this era of COVID-19, the experience of pregnancy has become different. And joining me today are two senior obstetricians from our group, Dr. Varalakshmi, who is in charge of our Kondapur unit, and quite a few of her patients must be logged on over here now, and Dr. Swapna Puskuru from our Hydernagar unit. They come with a wealth of experience in the field of pregnancy and childbirth, and the three of us together will endeavor to clarify as much as we can about COVID-19 infection and pregnancy. But before I even start, I will issue a caveat. Research has keep pace with the rapidity with which this disease has spread. Even as we speak now, new evidence is constantly emerging on how to manage various aspects of this disease, particularly in relation to pregnancy. So some of this data may change and some of this advice may change as new information emerges, and we will try to keep you updated with this by regular knowledge sharing webinars. So let's get started now and talk a little bit about what are the challenges and worries that we are hearing from pregnant women. Varalakshmi, can you take this and speak to us a little bit about what's bothering pregnant women most during this period?
Yeah, most of the pregnant women are worried in this pandemic about the virus itself, like what will happen if they are infected with the virus. What is this virus going to get affected to the baby? How is their antenatal care going to be? Many women now are worried. They actually, because in many places, even the hospitals, some places are not working in their regular hours. So they are worried about what are our timings, whether we are actually seeing regularly these patients, how the antenatal care is going to be, because like in pregnancy, it is a matter of 9-10 months where they have to have regular checkups. And if they don't have on time, what is the impact of this going to be? And also we see a lot of other issues with these women where they are worried about like their family support, where their parents are planning to come, but now because of the situation they're not able to support. And also many women, when I see about like lack of support in their home household support, and also they are overwhelmed with all the news that they get in the media and TV. And at the end of this discussion, I'm sure all of you will, the way this discussion will go, that you will, as the biggest maternity unit in the city, as a group, we have set into place a lot of systems where most of your worries will be clarified.
Yeah, I agree with you, Varalakshmi. I think that initially that was the biggest worry. Our hospitals even open. Can we go for a delivery? And then when it became evident that this would happen, people were also very scared about actually coming into the hospital, because they were worried about what would happen if they visited the hospital. Would they be more prone for an infection, and what are the kind of precautions they have to take? This led to a lot of anxiety and this lack of mobility and lack of family support. And is there anything specific you would like to add to this, Swapna?
See, this pandemic has changed because, the family support is not there. They're worried that how can they take care of the baby? How will they manage? Initially, it was fine, but after counseling them, now they can understand it's not that difficult. They are able to do themselves. There is a support from the husband and from the staff. They're able to manage. So it is not that difficult. It is same as before. Not much change the pandemic has there. Only thing is the confidence that they can do even without much people, much family support, which was there initially and not there. That they were scared, but when they went through it smoothly, now they are confident, and their friends went through it, so they're sharing, their friends are sharing, the healthcare personnel are sharing their experiences. So now the patients are becoming confident that they can go through without much help which they are getting from the family or from the society.
So it's getting better. So, so would we consider that pregnant women would be more vulnerable? Lakshmi?
Yeah, with the past experience with the other viral infections like swine flu and all those other viral infections, because the immunity is in general less in pregnancy. One of the biggest worries when this pandemic, when this coronavirus has started, is that there will be like overwhelmingly high incidence of this viral infection in pregnant women. But one of the good things about this infection is, although it is very highly contagious, it is not different to the infection rate is not different in pregnant women as compared to the same healthy age group adults. So and also if you look at the effects of this virus on pregnancy, again it's not very serious as compared to the same age group healthy adult women. So and if at all they may have mild symptoms like cold and flu-like symptoms.
Yeah, I think that's becoming increasingly evident, even in terms of the general, impact that this disease is having on the population in general. We have seen that around over here now, that majority of, people will get the infection now that it's come into the community. But the good news is that majority of them will have a minor flu-like illness and they'll recover from it with, minimal support. And there's a small minority, obviously, who will require extra support, and, and we are understanding better and better how to provide that extra support also now. So pregnant women are no more at risk, yes?
To add on to this, only the women who have other comorbidities, like in any other adult population where people with other comorbidities like diabetes or hypertension in pregnancy, these are the women we are taking care of more carefully on these women, because it's like any other adult population where they have more problems and they're at high risk. So these are the women we need to follow up very regularly.
So Swapna, please, could you like educate about, what is it that specifically that pregnant women can do to avoid getting this infection? How can they protect themselves in this pandemic era?
Yeah, because even though the results are saying the pregnant woman is better, but it's always better to prevent getting the coronavirus by staying at home, avoiding all social gatherings. If it is definitive or imperative, definitive, they have to go out, they have to maintain social distancing, at least 6 feet, keeping 6 feet apart. Most important, covering yourself, nose and mouth, wear a mask mandatory. Don't touch your eyes, nose and throat until you come back. Wash your hands, use sanitizer properly. And most important thing is, do not, until you wash your hands, do not touch your face, mouth, eyes and nose. And avoid going outside as much as possible. Stay at home, keep everything ready, keep at least 15 days to 1 month of groceries, things which are essential at home, so that you don't have to run in to get some things every day, go out, get things. To store things, use all as much as possible. Avoid visiting people. Okay, and more important things, social gatherings are more important things to avoid.
Anything to add to that, Varalakshmi?
Yeah, I would say the most important thing we have learned over the past few months on this pandemic is that please avoid social gatherings. And also, not only the pregnant women, the people who are taking care of them, husband, or who are helping them with household activities, they should be extremely careful. Only unless it is absolutely needed, avoid social. See, whatever research is going on about the medication, whatever it is, ultimately it comes to social distancing and keeping yourself safe.
I completely agree. I think the most important thing here is to remain sensible. Prevention is far better than cure. While we are progressing in terms of cure, I think we've learned that if we work hard enough, we will be able to prevent getting this disease. And the most important thing on that count is social distancing. Wear a mask, maintain this 2-meter distance or 6 feet distance when you're sitting, use well ventilated rooms wherever possible, and even families, like I can't agree more on that count. Even families should be extremely careful, families of pregnant women, in terms of the exposure that they're putting themselves to. That is the single most important take home message with regard to prevention: social distancing, wearing masks, sanitizing, personal hygiene, washing your hands frequently. Nothing can be more important than this at this point of time.
To
So,
add on
and
to this, over the past few months of experience, we have seen that people who are turning positive are from their own friends or family members where they think it's safe to interact with them without mask. It is safe to go out without mask. So that is one of the very important things, that you should be extremely careful where the people, even though your husband, if he is going out, be very careful with people who are going out and getting exposed.
so again, the other thing is people worry about, what impact will it have on the fetus? And I'm going to repetitively say this through this whole knowledge sharing seminar, that, research really has not been able to keep pace with the rapidity with which this pandemic has taken over. So, and there's a lot of hard work going on now to understand, what impact it will have. But a lot of these questions have come up over here. The audience is also asking us, what impact can it have during pregnancy? Can the baby be impacted if I develop the disease during pregnancy? What little we know at this point of time, the news seems to be optimistic. There is really no increased risk of miscarriage. There's very little evidence right now to say that there's transmission from the mother to the baby via the placenta, what we call vertical transmission. Small study groups have found that there's an increased risk of preterm birth, but again, this has to be stratified to see in which group of women this is more. Obviously, there is one small subset of women who Dr. Varalakshmi has mentioned to you who have a risk of developing a more serious disease. These are women who have what we call comorbidities, like, already pre-existing medical disorders, particularly things like diabetes and hypertension and obesity. If these are present, then the course of the disease in these women is severe. So these women also tend to have more complications related to pregnancy, and which would be, maybe an increased risk of preterm birth. But at this point, it looks like there is very little impact on the baby if the woman who, if a pregnant woman develops this disease. And we are waiting to hear a little more about this. So the prematurity thing, we really have to interpret it in a more sensible manner. Sometimes the severity of the disease itself may warrant that we deliver the woman early, not that she's gone into preterm labor. And this again applies to women who come with comorbidities, in whom we have to be very careful, because they definitely will have a more severe course of the disease. And so is there anything that you would like to add to this, Varalakshmi or Swapna?
The complications, all the complications like miscarriage, IUGR, or congenital abnormalities, which is women are worried about, are not at increased risk in COVID positive patients. The only risk which you're mentioning about preterm labor could be because of temperature, which can otherwise also lead to higher temperatures, preterm labor. Or other comorbidities associated, or some in earlier days where this pandemic was in very high incidence in China and places like that, they were worried that the effect of, because they didn't have much experience at that point, and they are thought that they have to deliver the women so that the impact is not higher on them.
Yeah.
So the same. any infection as such has a risk of preterm labor. I think even this is also has the same risk as other infections.
Yeah. Yeah, and coming to these challenges and worries, one thing specifically, I would like some comment on is, how it has impacted in terms of, the mental health, stress, anxiety, depression. Lakshmi, can you comment on this?
Yeah, definitely, when we see these women, pregnant women coming to the clinics, one of the things they are very commonly expressing these days is about worries about this infection in pregnancy. So once we talk to them through their worries and anxieties, most of the times they are fine with it. But there are a very small percentage of women where they are extremely anxious about this, and like if so we tell them about like problems, like if they are very sad, they are not able to get over it, they are unable to sleep, if their day-to-day activities are affected because of anxiety and worry about the virus, that is where they need help. And then we always welcome them to contact us through either video consultation. If it is not helpful, then call them directly. And sometimes we also encourage them to talk to our counselor if it is going to impact their pregnancy. But most of the times, majority of them, one consultation with the obstetrician and talking to them through their anxieties is most of the times helpful.
Yeah, and I think social media doesn't help in this, situation, because there's so much of misinformation which is being spread. And so the single most important message to the patients is that if you're feeling anxious, if you're feeling stressed out, consult your doctor first. Please don't, look to other sources of information. Even if you look to other sources of information, look at validated sources like ICMR or the WHO. These are, websites which will provide you with authentic information. Don't look at messages which are coming to you on WhatsApp or being put up on Facebook and which have no relevance or no backing. So either consult your doctor and get it cleared, because once anxiety sets in, it will just, keep on going and getting compounded. Pregnancy itself is a lot to deal with, in normal situations. And when there is this kind of a pandemic going around, I don't think you should take this additional burden of trying to sort out information and filter information. If you want to filter, go to authenticated websites like the WHO, like ICMR, or better still, go consult your doctor. And now with telemedicine available, with video consultations available, your consultation with the doctor is just a click away. We are encouraging women to do as much of video consultations, as much of telemedicine as possible. So if you have any form of concern or doubt, you don't even need to step out of your house. Just click and get a consultation with your doctor. So now, yes.
And the news channels, avoid watching all the things which are giving them the negative information, like news channels and all, then rather than looking out for the positive things, than looking out for the negative, what is this happening, that happening.
And so now this is the important thing. So, this was something that we had to really put our heads together and look at a lot of information which came out from, important bodies like WHO, ICMR, that how are we going to manage antenatal care during this pandemic? Because there was a point when we had the lockdown when pregnant women were just helpless. They were worried about what was going to happen and, where they should go for checkups and if they could actually step into hospitals. So as an organization which has been caring for pregnant women and particularly for children from a long, long time, we felt a great sense of responsibility in providing ongoing care during the pandemic, because we firmly believe that, the outcome of pregnancy really influences the outcome of societies in general in future. Because if healthy children are born, you're taking care of the future of the society. And we also are very much aware that, certain care during pregnancy, certain investigations are extremely time sensitive. Like for instance, if you have to do screening for Down syndrome, you have to accomplish that before the 13th week. If you have to start looking for anomalies, you have to accomplish that before the 20th week. And so these are things that we'll talk to you in detail. But as an organization, we really worked hard to provide what is called modified antenatal care during this pregnancy. And the principle of this was completely simple. We kept it very simple. We said that we have to define what are absolutely essential visits and keep them to a minimum. And we brought this down to about 4 during the entire course of the pregnancy. And the rest of the visits were supplemented virtually. We encouraged telemedicine and video consultation. And we were really backed by an excellent IT department. They set it up in a record matter of about 48 hours, our teleconsultations. And we also work very hard to accomplish the maximum during each physical visit, like we want, and we'll go on and discuss that. So we maximized every visit so that the patient didn't have to come into the hospital more frequently. The visits were very, very infrequent. We increased the space while we continued to provide support to them, through teleconsultation. And so we'll go on and look at what this modified antenatal care was that we set up during the course of this pandemic. And it has been hugely successful. And, it's provided a lot of comfort to pregnant women that they were getting what was absolutely necessary during the pregnancy, and we were not missing out any high risk cases. And so let's go on and look at, what happens during the course of a hospital visit. So this was one thing that we had to actually reassure pregnant women about, that when they came to the hospital, that there were methods by which they could keep themselves safe. And we also were working very hard as an organization to make sure that they were safe. And so a few things on this, Swapna, can you comment on, what is it that women should be careful about when they were planning a visit to the hospital?
Yeah, before coming to the hospital, first have an appointment and then know what you need to carry to the hospital. Don't be unplanned. Okay, first appointment, and then what all, how many weeks you are. Then once you visit the doctor, check all your weight, blood pressure is checked, your what is supposed to be done. You visit the doctor, what investigations you need to get it done, and what scan, and when to get the scans, when to get the investigation, what medicine you need to take, when should you come next, and what you need to monitor till you visit the doctor next time. All these information will be given by your doctor, and you also make sure that all the information what you want is you have gathered it and jotted it down so that you don't forget, because a lot of the times patients forget and again they get confused, again come to hospital and all. So what all are your doubts, you need to write down in a paper before you come to hospital. Finish all your investigations, your scan, your consultation and medication, adequate amount of medication, and know when is your next visit, what are you supposed to do in the next visit, in between, before your next visit, what you need to monitor at home. All this information is better, and once you reach the hospital, make sure you wear a mask and your temperature is checked when you enter into the hospital, and fill your form correctly, give all the information which they ask for, and until maintain social distancing in the hospital also. Cover your, if possible, wear your face shield also and come. And once you're done with all this, once you go home, again wash your hands thoroughly, take bath, and then again you can touch your eyes, nose and mouth. Until then, do not touch them.
So to that end, actually, as a hospital, what we are doing as an organization is that whenever we are making an appointment for the patient, we are sending them written information about how they should come prepared to the hospital for a visit. And we've also worked very hard to, make our facility compatible for social distancing. We are only having a single point entry right now into the Birthright division of Rainbow Hospital, and there's a declaration form that you have to fill. We've changed the entire seating arrangement of the hospital, and we've also ensured that as doctors, we are staggering our timings so that there's no crowding at one given point of time. So the number of doctors who sit simultaneously have down, and we've staggered timings tremendously so that patients are able to maintain social distancing when they come into the hospital. So if the visit, first you have to consult your doctor, the first consultation should be by a telephonic consultation. Come to the hospital only if your doctor deems that it's essential for you to come. And the precautions that Dr. Swapna spoke about, you need to use a mask, you need to practice personal hygiene, and we are also strictly saying that only one person can accompany you to the hospital. You should not bring more people. While we do agree that it's a family experience, it's also essential that you have this, because there's nothing more important than social distancing. But Lakshmi, do you have anything to add to this?
Add on to this, as a hospital, we also, to protect other patients coming at the entrance itself, checking the temperature and oxygen saturations, and people who are coming with symptoms, we are strictly isolating them so that they are not mixed with the general normal pregnant women. So in that way also, we are keeping everything safe to reassure.
So somebody's asked us that, do all the branches of Rainbow have video consultation facilities? Yes, the answer to that is a yes. Please go onto our website and you will be able to find a click. Your consultation is just a click away. And remember, that should be your default method of consultation. Once you've spoken to the doctor, and if the doctor deems it necessary that you have to come to the hospital, please do come to the hospital. So one of the essential visits we've defined is the 12 to 14 weeks visit. And Dr. Varalakshmi will talk to you about why this 12 to 14 week visit is deemed essential and what happens at this visit.
Yeah, as soon as you test positive pregnancy test, what we would suggest, we are suggesting our patients is to have a video consultation to talk about when the next scan and what are the investigations, what care do they need to take in early pregnancy. So once that initial consultation is done, the first appointment, the first visit to the hospital, we are asking them to come is between 12 to 13 weeks, because there's a very important scan which is screening for chromosomal problems in the baby. Not only that, the initial booking, the scan, because it is very time sensitive, this scan. So along with the scan, the initial booking visits, booking investigations, all the blood tests can be done, and same time the scan, blood test, and it can be also combined with the consultation with the doctor, where the doctor will talk about the common problems. The problems can be addressed. Not only that, the care plan during the entire pregnancy you can discuss with the doctor. And also, one of the most important things at this visit is the risk stratification, because we call in pregnancy there is something called as low risk pregnancy and high risk pregnancy. So to some extent at this point itself, checking the scan will also include not only down screening any problems that we may see in future, like preeclampsia screening, where the women might be at risk of blood pressure. So we do the risk stratification, and then individualize the care in pregnant women, where some women may need more frequent visits, or most of the times it can be in low risk women, combined with video consultations where the visits can be limited.
Yeah. So you agree, Swapna? I think we'll move on to the next question.
Yes, sir.
So one of the questions interestingly asked by a member of the audience is, should I even get pregnant during a COVID-19 pandemic? And the answer to that is that at this time, there are really no recommendations suggesting that you should delay trying for what we call a spontaneous pregnancy, getting pregnant on your own. But obviously for people who are undergoing infertility treatment and who need what we call assisted reproductive methods, I think it's important that you should consult the fertility specialist and then only decide whether you can go ahead with these procedures. But there's absolutely no cause for alarm if you're already pregnant, that you can continue the pregnancy with this form of modified antenatal care. And now we've been seeing this for a long time and the outcomes have been good. People are doing very well. So there's no real reason for delaying. But the only caveat here is that if you're planning a pregnancy, ensure that your other general health parameters are good, which is what we do for all women who are planning a pregnancy. And that's, I think, something that you need to, be mindful of. And anything to add to this, Swapna? People can go ahead as long as they're in good health,
yes,
in general.
But only during the attack, if they are already having COVID or COVID-19, that 1 month or 1.5 months, it's better they don't plan.
Yeah. Absolutely. I think that's an important message. If you're already positive, I think it's not. So this is what happens at a 12 to 14 week visit. And this is considered an important time sensitive visit, which is because this is where screening takes place, for chromosomal disorders like Down syndrome and for preeclampsia. And this is the most important visit where we do risk stratification so that we can divide women into low and high risk pregnancy. And we are encouraging, like I said, we are maximizing everything during a physical visit because we realize how precious and how precarious these visits are, how much of a problem it is for a woman to actually now get up and come to the hospital, and so much care has to be taken. Hospitals themselves have to work very hard to provide a safe environment, not only for the women who are visiting for antenatal care but for their own healthcare workers. So it works both ways, and hence this is a very time sensitive visit, and we try to finish all the blood work, investigations and the ultrasound scan, and they consult the doctor and go home. And one of the other efforts that we have made is that all these investigations are checked by doctors. So we are checking the investigations and we are calling patients back and reassuring them if their reports are normal, and if something else needs to be done, we are informing them on telephone so that they don't have to come to the hospital just to show us reports. Since these are being done in our own hospital, the reports come directly to us and we are checking them ourselves, and we are making sure that unnecessary visits are reduced. So once they finish this visit between 12 to 14 weeks, we are asking them, we are doing a video consultation, a telephonic consultation to discuss results, and then we are asking them to come back only at 18 to 20 weeks. And Swapna, can you kind of elaborate on this 18 to 20 week visit and what is done at this?
Yeah, 18 to 20 weeks. So there's an anomaly scan, which is a very important scan. This is done to check all the structures of the baby are normal, what is the cervical length, and the whole formation of the baby is normal, or is anything serious or to be done is monitored here. Again, we check the blood pressure, we check there are set of investigations which are done. There is investigation to detect any diabetes, gestational diabetes. We do check at that, and then a vaccination is there. Tetanus shots are given, and other immunization. We do have flu immunization is given. These are all checked at this time. So when you come for an anomaly scan, book an appointment for an anomaly scan. Once the anomaly scan is done, visit your doctor, wait, blood pressure is checked. If everything is normal, immunization, blood investigations are done. So this is a very important, because once this is missed, according to guidelines, MTP guidelines of India, after 20 weeks, if any problem is there for the baby, it will be difficult to manage after 20 weeks. So it will be nice if it is completed before 20 weeks.
Anything to add to this?
I think after the NT scan, this is one of the most important things that is essential not to miss. Between 18-19 weeks, we schedule an appointment and they come and get the scan done and discuss with the doctor. So this is one of the other scans which should not be missed, and you definitely need to come to the hospital. And to add on to this, we also are taking all precautions in the scan room to maintain the social distancing, and only one person goes into the scan room, and sanitizing, including the machine, the doctor taking all precautions. And some people are worried about coming for the scan, but because all the precautions are taken, and these are the important scans, I think you should not miss these.
Yeah, I agree completely. This is an extremely time sensitive visit, both in terms of the mother and for the outcomes for the baby. And this has to be tied in uniquely to, the Indian law with regard to terminations of pregnancy. So it has to happen in this time frame. And that's why we call these as time sensitive visits. And once again, we have taken a lot of precautions in terms of keeping the scan room, as patient safe as possible during this pandemic, and you should not hesitate to come and finish this. So once we've finished the 18 to 20 week visit, we advise that a woman, they don't come back to the hospital, but do a video consultation at 25 weeks. And this is important because we have to check on an ongoing basis how the woman is doing. And it's also reassuring ensuring for the woman to be able to have a consultation with her own doctor about 4 to 5 weeks after her scan. And we educate them about, we take this opportunity to educate them about home BP monitoring. You know, we are encouraging all pregnant women to buy a BP apparatus and check the blood pressure at home, because that's one of the important parameters that needs to be checked. And if that changes, you know, it can change the whole course of pregnancy, and we want it to be picked up early. And it's a fairly easy thing to do at home, and we try to teach them that when they come on one of their visits. There are some women who may need more frequent monitoring of blood sugars, and we are encouraging these women actually to buy their own glucometers and check their blood sugar levels at home. And like Dr. Varalakshmi mentioned, also this is, you know, in this 4 to 5 weeks, a number of things could have changed for the pregnant woman at home itself. Her home situation can change, you know, people who she expected to come in for support may not be there. So it's also useful to discuss with them their mental well-being, give them an opportunity to, you know, discuss with us what their anxieties are and allay them, and, you know, keep them more comfortable, because eventually this entire experience of pregnancy and childbirth should not be lost on women, because it's a very precious period in their lives, and I think they should be able to enjoy it as much as they can, even given the current circumstances, and I think that's very possible. So I think a video consultation before they come for their actual physical visit at this stage is very important. And it's also useful, then we can also discuss with them the importance of antenatal classes, and that's something, you know, I would like you to comment on, Varalakshmi, the importance of antenatal classes and how we've kind of reorganized them in this time.
We have an excellent system of conducting antenatal classes. These classes are divided into like trimester class, where they talk about like common problems you encounter in pregnancy. And you know, most of the problems in pregnancy can be dealt with some tips how, because of the changes in the body due to hormones or physical changes. So they give tips for common problems. They talk about diet. They show you some exercises how to do at home. And so that is all about the trimester class. And they also prepare for preparation of childbirth. We have labor preparation classes and breastfeeding classes. So earlier we used to have these classes on site, but now because of during this pandemic, we have made these classes also online. So we are having excellent response for these classes, because it's very, very helpful to the women in educating them how to take care of this pregnancy during this time.
Swapna, anything to add to this?
Yeah, this is also because of the changes what the body is undergoing and the stress of the pandemic. Both physical and mental stress is addressed by this. So most people are attending it and they're very happy with them.
Yeah, so I think it's also, see, again, a social interaction without actually physically, you know, interacting with people. We used to find that very good. Even when we did this on site, you know, it created a nice community of pregnant women who were pregnant at the same time, and they could interact when they came for these classes. Not only were they educated about, you know, the various changes, we have an excellent childbirth educator, Rekha Sudarshan. She's very good with this whole process. And not only were they educated, but they were able to make friends, and I think they also were able to ensure friendships for their children when they were born, because, you know, they were all pregnant at the same time. So it was a very good community interaction. And now we find that even for when they interact online, it's a kind of a social outlet for the pregnant women. She's able to participate in a group of peers who are going through the same experience, and it gives her the opportunity to, you know, talk about it and raise these issues and learn something new about how she should manage her pregnancy. And
she also guides about the diet. What a lot of women do have doubts about the diet in pregnancy. Mrs. Rekha Sudarshan guides them so well about what is important, how to take the healthy diet and the exercises, the importance of it. So they really like it.
yes, so somebody is asking us, how do we sign up for antenatal classes? Again, this is, you know, just go on to our website and you'll be able to sign up for classes. Call and we'll be able to give you information about how to sign up for these classes. We also use this 20-week visit to educate women about what happens at their next physical visit, which is going to happen at 28 to 30 weeks. And, we speak to them about how they should come prepared for that visit and how they're going to, what are the investigations that we'll be doing. And so it's very important to have this one video consultation in between your physical visits. So what should then we ask you to come back around 28 to 30 weeks for your next visit? And what happens at this visit? Well, Lakshmi, could you comment on why is this again a time sensitive visit? So these are the important issues we are commenting on. Why this physical visit is essential and why it has to take place in this time period.
Again, at this period between 28 to 30 weeks, important things that we look in is screening for diabetes. Asian women, as we all know, are very high risk for, so we routinely screen for diabetes between around 28 weeks. So when women come to with the diabetic screening, we also take that time to do one growth scan to check how the baby is developing and the growth of the baby is. Not only the growth scan, they'll have an opportunity to interact with the doctor physically, and then to have a look at how the blood pressures are through this period. Not only this, one of the important things is a growth scan at this point, so that so same time at the time of growth scan, you can check the reports, and then the other important thing is the immunization. So around 20 to 30 weeks, we also give this triple vaccine, where it's called as, which is important for the baby's protection. So these are the important things. So after the video consultation, at the time of the video consultation, around 25 weeks, you can come prepared with organizing for a scan. Our staff will contact you with the scan date. So at the same time, you can combine the investigations, the scan, which can be shown to the doctor and discussed. And again, a re-stratification of the risk is done at this point.
A correction of anemia, if any anemics and all, will be.
Yeah. So this is the third essential visit that we have done. We've done one between 12 to 14 weeks, one between 18 to 19 weeks, and now at 28 weeks, the other scan. So at each visit, we are able to also risk stratify. If we pick up any problems, we are able to pick up that small section of women who may require more frequent care, more physical visits, and risk stratification is occurring at every visit again. And again, we try to maximize, pack in a lot into one visit, so that we can finish most of the things when the woman comes into the hospital. Now there's a question from the audience, and I'm glad somebody asked this question, because this is something I think we should all address. How do we build immunity in pregnancy? So this is very often, people ask this question a lot, and I would really like to use this opportunity to clarify something, that see, immunity will not come through short-term consumption of supplements and vitamins. Immunity is actually very multifactorial. It's complex. It's not fully understood. But the bottom line, I think everyone agrees upon, the immunology experts and everyone agrees upon, is that immunity is a long-term phenomenon. It starts very early in life. It starts with you investing in a good lifestyle, a nutritious diet, regular exercise, enough rest, maintaining a healthy weight, getting enough sleep, not smoking, consuming alcohol in moderation. So it should be viewed as a very long-term investment. It is something that if there's one single thing that this pandemic has brought to the fore, it is to understand that investing in our health is extremely important. It has big, long gains. You will not even get it in any other form of investment, your mutual funds, your shares and stocks. Nothing is going to give you the same amount of value as investing in your health will do. And investing in your health needs a lot of commitment from you. It needs that you should set aside time to take care of yourself. You should set aside resources to take care of yourself. And you should really, follow the right methods, correct allocation of resources, time. And our first line of defense is therefore to choose a healthy lifestyle. There are a number of products on store shelves which claim to boost immunity. And please don't consume this until you have actually got a go-ahead from your doctor. Because, it makes very little sense. There are different kinds of cells which participate in our immune system, and we don't know which one of them responds to which infection. That's still under study at this point of time. So don't pick up things off the stores, shelves, or off the internet which claim to, boost immunity. So it's important that we should supplement things which are deficient in you, supplement things which are absolutely essential for pregnancy, but make sure that you consult your doctor and start investing in improving your general health. And this is not just for pregnant women. I know I'm talking to people in general, those of you who are planning a pregnancy, husbands who are listening into this webinar. Invest, immunity is a long-term process. It will not happen in a short-term manner. And I think we have to start realizing, not just as individuals, even healthcare systems, I think, have come to that realization that it's very, very important to invest in health. Anything to add to this?
Totally agree with what Dr. Pranati is saying. It has to be a long-term, immunity is not like one-shot thing. It has to be a long-term healthy lifestyle changes. In fact, I'm very surprised with somebody who was deficient in vitamin D came and prescribed the medication, and she came back saying that the medical stores are out of vitamins and general vitamin medication like zinc content, because it's so much of information on the media that if you take just one pill of multivitamin, your immunity will boost. That is not how it works. It has to be a healthy lifestyle change, which has to be long term. It can't be just you take a pill and you get the immunity ready. So that is one very important.
For anything, it's everything is to be dedicated, disciplined life.
So once we are done with that, I'm actually happy that somebody asked this question, and I hope that's very clear. The answer from all of us, we agree with this. And so before your next physical visit, again, we ask you to supplement it with one teleconsultation at 32 to 34 weeks. Swapna, can you kind of, elaborate a little bit on what we do during this video consultation?
Yeah, in this video consultation, we'll again ask for any concerns which the woman is having regarding how the movements are, because this is the time where they set in the bump shows up, the back starts hurting, all this, then how they're doing it, how they're coping up with their work, how the baby is moving, any changes in their blood pressure, how any swellings or any changes in their body which they're concerned about. All these are addressed, and we'll inform them the warning signs when they need to come to the hospital, what are the emergency numbers they need to contact if they have to come to the hospital. If the most of the whatever doubts regarding their pregnancy, regarding their diet, regarding their health, what is the future, most of them have concerns at this time about the delivery, because that's what, and how they're going to plan the delivery. All these information is given. There are labor preparation classes. Again, we ask them to attend these labor preparation classes, because you can't, one day before you can't prepare. Labor is something like, running like a marathon, and you can't prepare for a marathon in a one day or something. So they have to do those exercises. So those exercises are discussed, those breathing concerns, those difficulties, the digestion problems, what are discussed, and the plan is given. Whom to contact, where to contact, when to come to the hospital, everything is explained to them. And the next scan, when they have the next scan, and all is discussed with them.
So the supplementing video consultations between actual physical visits helps a lot, even if it's for a reassurance value, and it should happen. And the next visit is between 36 to 40 weeks we do this, and this is again a very time sensitive visit, because we want to look at the growth of the baby at this point of time. We want to make sure that if any hypertension develops, this is one of the times to pick it up, because this will again change the whole plan of delivery. So a physical visit is important at this point. We also use this opportunity because once you are between 36 to 40 weeks, your due date is approaching. So we talk to you about, your delivery plans and what needs to be done. And this gets individualized because it's different for every patient depending on, what issues they have and how straightforward or not straightforward the pregnancy is. So based on all that, we kind of discuss the delivery plans. We also make it very clear what will happen? Would you need an induction of labor? Would you need a cesarean section? Again, this is all very much individualized. And this visit is essentially to tie up all these things so that, we are able to kind of give them a plan about what's going to happen in the next 4 to 5 weeks. So that's the final visit that we do. So these are the 4 visits that we are deeming as essential. And depending on each individual patient's needs, some of them may need a few more visits, and you definitely will know the reason why we are going to ask those few more visits. We'll discuss that with you only and then do it. And then comes the most, I think, the biggest question on everyone's minds. What if I test positive? What will happen to me? And I think, let's bring in Varalakshmi to talk about this important issue. What is going to happen if I'm going to test positive when I'm pregnant?
Yeah. First thing I would like to tell you all over here is that not to worry. If you test positive and you're remote from term, that is, you're not close to within less than a month from the time of delivery, I would say do not worry. You're not alone. We are there here to support you. So we have a very good system in place where we started doing this called home monitoring, and we have a system where these women who are tested positive are at home. Unless they are absolutely required to come to the hospital, it is not required. So this particular system we developed where there are home consultations are done through video consultations. So every single day you are provided with a lot of like essential stuff that are useful to monitor at home. So these will include, like, we provide with a glucometer, a home BP monitoring, we provide with masks, and we tell you to stay at home, not to come to the hospital, not to go out anywhere, stay in a well ventilated room, preferably which has an attached bathroom. So we are also giving sanitizers, and the place can be, everything is provided, including masks. So every single day, the system is in such a way that every day your monitoring will be, you will get a call from the hospital asking for all the important vitals, what your temperature is, what your oxygen saturations are, and also most importantly, the obstetrician will be in touch with you every couple of days, and we have also to physician consultations. So any essential investigations need to be done, and then those reports are sent to us back. So it's a very good system in place where you do not worry about getting tested positive. So we all, based upon the monitoring every day at home, we give you advice when you need to come out and get it checked with a physician. And most of the times, in the experience over the last 1 month after we introduced this system, it's working out very well. In fact, our patients are really happy with this. And to just give you an example, one of my patients who needed because one of the investigations are high, is not abnormal, and the physician has advised to take low molecular weight heparin, which is a injection to be taken at home. So our nurse has actually demonstrated to the husband how to give the injection at home. So they were really happy, and they are able to continue the care at home. So this is one of the important things to reassure our pregnant women that we are there through to take this pregnancy safe. So do not worry.
Even dietitian and physiotherapy regarding the breathing exercises and all are explained in that.
Yeah, so that is the single most important message. I think, don't worry if you test positive. I mean, this is bound to happen, which the way the pandemic is. There's an excellent support system which is working right now, and it works very well. You're monitored on a daily basis. The obstetrician speaks to you, the physician speaks to you, and at regular intervals. A nurse is in touch with you almost every day, and we have warning signs. We have very an extensive information leaflet is sent out to you as to what are the do's and don'ts, including what are the do's and don'ts for your family. We've listed out what your family members should be doing, shouldn't be doing, how they can provide you with support. There's a lot of practical information, how you should be cleaning your dishes, how you should be washing your clothes. Everything is listed in this information leaflet. So there's really nothing to get panicked about. And then again, the next question that, it's here, the people are worried about what's going to happen. How do we handle COVID positive patients? Where do they deliver? So one of the important things, again, a lot of thought has gone into this, because there are two sets of people that we need to take care of, and there is one common condition that we need to take care of, that is pregnancy and childbirth. So this can be, you could be COVID free and you're ready to deliver, you could have COVID and you're ready to deliver. And as an organization, we are dedicated really to the well-being of pregnant women, and also to make sure that the experience is positive to both groups of women. So we've strived very hard, and we've maintained all our hospitals, all our main 5 branches in Hyderabad are completely COVID free. And for the women who test positive, we have not abandoned them. We have a dedicated center now to deliver women who are positive, and this is away from all our 5 branches. This is on road number 10 in Banjara Hills. And for those of you who test positive and who need delivery, we are counseling you thoroughly. Again, this center has all the safety parameters in place. We have very good dedicated input from a physician in this center. We have also worked very hard not to take away the joyous experience of pregnancy from women just because they turn COVID positive. We want them to be taken care of. We want them to enjoy this whole experience of giving birth. And so that center has been designed to look after pregnant women, and at the same time keep our other hospitals free of COVID so that the infection doesn't spread. And this is this whole social distancing policy that we are following for the positive women, while not taking away this entire experience of women who turn positive. So I think both groups of women can be reassured that we have dedicated centers for women who are COVID free, and for those who turn positive, we have a dedicated center for you where we've kept all parameters in terms of safety, well-being, and we are backed up by neonatologists over there. So the same policy what Rainbow works for, taking care of pregnant women, taking care of newborn. We have a full-fledged neonatal division also functioning out of that unit. And so you'll be taken care of very well over there. We have lot of questions about what's going to happen with regard to labor and delivery in this period. And I think, we'll keep those questions for our next knowledge sharing webinar, which will address completely in terms of, what happens to delivery, what happens to labor and women who test positive. What are the policies that we're following on our road number 10 branch, which is dedicated to these women, the Rainbow COVID Center. And we'll be there to answer all those questions also. So again, anything that both of you would like to add before we conclude this session?
Yeah, I think the most important lesson pandemic has taught us is that whatever it is, like, we adapt to the situation what we are, and make things better. And we need to and particularly the COVID has the important information I would like to give is that stay safe. Don't assume that you will not be the one who will get. And now that it is a community spread, go out only when it is absolutely necessary. Wear mask and stay away from groups. So these are the important things we need to follow.
Swapna?
Stay home, stay safe, and do not panic.
Yes, I think that's very succinctly put. Stay home, stay safe. Social distancing is the cornerstone, like the age-old adage that prevention is better than cure. I think that holds very much for this, and that prevention is very much in your hands. It depends on how hard you work to keep yourself COVID free. And if you do test positive, don't worry. We are there for you to take care of you during your pregnancy, during labor, during delivery.
We have very safe systems in place at every stage of your pregnancy. So reach out to us if you have any problem.
Yeah. On that note, we'll sign off. But one thing we have promised is that these knowledge sharing webinars with patients will happen on a regular basis, and you'll get information from us about the next one. And please log in and listen to these knowledge sharing webinars. Thank you very much for having attended. Thank you, Varalakshmi, and thank you, Swapna. for having participated and disseminated so much useful information. Thank you very much.
Thank you, ma'am. Thank you all.